Join us in welcoming Dr. Gary Gottlieb of Harvard Medical School and Author Health.
Thank you. So about 4 hours ago, Patrick laid out the gauntlet and gave us a set of challenges that I think Dr. Trivedi described as potentially boiling the ocean. And if you look through the windows here, we're right in front of the ocean. But I think the plan that's been laid out by the Alignment for Progress, by this conference, and the plan that we need to essentially summarize today and use as a catalyst to start taking action on each and every day to move forward on the work that so many of you have already done, and the work that's at hand is really going to be based on a lot of the playbook that David just laid out, but has some critical tenets. And I just want to remind you of them, because I think they're critical in making our plans going forward. And while these are aspirational, they're far less aspirational than the 10-year climate goals that we have for this country. They're far less aspirational than the goals that the Kennedy Forum had 10 years ago, and they're less aspirational certainly than the goals of 60 years ago, but they are feasible. And as Dr. Insel pointed out before, we're starting to make progress. We're trying to use some of the failures we've had to inform a future that's full of success. But that means that we have to have objectives that are measurable, that are clear, and that really and embrace the vision that Patrick laid out earlier, which is one, mental health as essential health. And that we're going to have to achieve that by having a movement, and a movement that is persistent, that's intense, that's focused, that's clear, and as all of our panelists have told us, is accountable and is measurable. So we're going to try to align to ensure, as we described in several different presentations before, that 90% of all individuals are screened for mental and substance use disorders. It seems relatively feasible. That 90% of those receive the evidence-based and, as we said in previous panels, the measurement-based services and supports that they need, so that we can be accountable to both measure in a way that's consistent, so that we can reward and have incentives that drive to measurement towards objectives and outcomes that are real and that are tangible, and that 90% of those who are treated can manage their symptoms and achieve recovery. That's clear, right? Patrick laid it out. 90, 90, 90 in 10 years. If we don't have an aspiration that we can achieve in that period of time, with the resources that we've described, with the expenditures and the need, then we'll be measured by the failure to achieve what is the essence of what healthcare and mental health care should be about. And that is our ability to take care of those at greatest need, to those who are sick and needy, and to make certain that great care, that evidence-based care that's based on science, that's measurable, and that's accountable, is what we can provide for those that need, and that we can use those tools to prevent as well. We cannot have the prisons as the street as the de facto mental health system. We need to have the structures that we know can work and will work, and that we continuously measure to determine if they do work. But that really calls, that kind of 90, 90, 90 by 2033 depends on several key pillars, and we've heard it consistently before. One is ensuring sufficient and comprehensive payment model that drives these outcomes. We've lived through a paradigm pretty much since the end of World War II with fee-for-service, employment-based medicine, as well as a number of government programs that have essentially reinforced the building of an illness care system, and a mental illness care system that's been fragmented and dysfunctional, an overall illness care system that hasn't met any of the public health measures and has not achieved universal health coverage. And that means access for everybody of high and solvable quality of care that's instantaneously accessible to each and every person with a high degree of equity. So a payment system, I think to some extent we're talking about critical and fundamental payment reform. Fee-for-service transactional care doesn't work for chronic illnesses. Fee-for-service transactional care doesn't manage populations, and it doesn't allow us to go upstream. And adequacy of payment is critical as well. So having 5% premium is inadequate. We're all living in an environment in which we're trying to figure out how to service $33 trillion worth of debt and growing on an ongoing basis. So there can be downward pressures on federal funding, and therefore downward pressures on private as well as public funding at every level. Therefore, we're going to have to think very, very carefully as to how we rejigger the incentives that are in the system and understand that some components of what are being paid for in general medical illness care are going to have to go for preventive medicine and preventive mental health care in order to build the systems that are essential to being foundational to achieving those objectives. If we say that the next critical principle is supporting a skilled and inclusive workforce that's equipped to address the needs of diverse communities, that means essentially getting the best and the brightest to care for the sickest and neediest populations. That means that these jobs in mental health have to be great. They have to be associated with evidence. They have to be supported. And they have to have payment that's consistent with how hard the work is and how essential the work is on an ongoing basis. And it has to mean that we have to tap the genius of our communities of color and those who have been impoverished and who have not had opportunity to take that genius and to inform us how to provide that care better. And frankly, to have a workforce that looks like the population that we need to serve so that we look carefully at eliminating racism in the way that provide care and much of the bias in the way that our services reinforce the stigma that's associated with mental illness. We heard from the CDC director that essentially who has been living with a somewhat tattered public health system that was tested and to some extent failed during a pandemic, that we need a public mental health system as well, which means we need to move fully upstream with primary prevention to understand where risk is, for secondary prevention for people who are at risk, and then tertiary prevention and tertiary rehabilitation for optimizing function within the context of disability for those who are not only at risk, but who are suffering simultaneously. That can only be supported by a fundamental pyramid that's built on those payment systems that we describe and a philosophy that moves away from illness and towards promoting health. And that means managing populations. This is all feasible. It's in everybody's playbook. It's in every payer's playbook. It's all of what we're talking about superficially around so-called value-based payment, but we can align those incentives and align them well. And remember, essentially, we're sitting with dollar streams that are disconnected, not just a fragmented payment system on the fee-for-service side that causes a fragmented delivery system, but multiple siloed payment systems that sit in state agencies and federal agencies. While we heard that the White House is trying to keep all of those agencies accountable, those dollars are sitting separate from one another. Even with good efforts like we heard in the state of Pennsylvania, those programs and the incentives around them are all in shells as opposed to being available around patients, around populations, and around their needs. And it is difficult to replan those efforts, but all I'm saying is 10 years, okay? It's a small amount of time relative to putting our hands up and saying, this fragmented system that's leaving people in the dust is acceptable to us. And finally, having that pyramid, working from that foundation and moving upward creates a tremendous opportunity for innovation. It creates an opportunity, markets for investment, taking small trials and moving them larger, letting innovators use their genius and find their place within new payment paradigms or new delivery paradigms. We've heard about wonderful new programs or pilots, wonderful small companies that can then be scaled. But there has to be an environment and a playground that's big enough for them to be scaled in. And that requires the collaboration and public-private partnership from the bottom up. And essentially, Patrick has laid that out for us. If we can't meet those objectives and start to move backward, if we can't build those pillars, we're going to be sitting here again 10 years from now. And that's unacceptable from this perspective. So you've sat here today, you've spoken today, you've participated, you've worked for many years of your life to try to find solutions. Sometimes they're small solutions, sometimes they're giant, or as Richard Frank would say, wonky and policy solutions. We just heard David lay out a policy and a strategy handbook for us to be able to have a playbook to start to get started in an advocacy and planning process to be able to achieve these objectives. We now need to check the boxes of each of the building blocks that are necessary to achieve them, and they will be built upon really those 4 pillars to be able to get to 90, 90, 90 in 10 years. Thank you so much.
I don't know if my mic works, but let me just say, Gary was one of the first people I went to ask for help when I put this first Kennedy Forum event together. And I walked in his office and I'm like, I wonder how much I could ask him for, $10,000, $20,000. Do you think I can do that? He said, what can I help you with, Patrick? And I said, well, we're trying to get some money raised for the event. he said, well, can I give you $100,000? And I said, that would be great. But I'm just here to tell you, like Gary, you could tell, knows this, feels this, spent his life. He's president of the American Geriatric Psychiatry Association, ran one of the biggest health systems in this country in Partners Health. I've got people like Gary, Steve Hyman, Josh Thomas. I got really smart people who want to make a difference. If we can tie this campaign together where we can get the funding, the industry supports, we can go in the right direction, because it's not for lack of really strong people like Gary and so many others who are helping us get there. So thanks again, Gary, for everything.